Do you know what blood pressure is? Hi, you guys. This is Cindy Talley with Aging Joyfully with Cindy Talley RN, and I'm coming to you today on a part 2. Yesterday I talked about what is cardiovascular disease and are you at risk for it? And we found out that women over age of 50, half of them all usually die from some form or type of cardiovascular disease. So I want to talk about blood pressure. What is blood pressure anyway? So blood pressure is that pressure that's being put on the wall of the arteries as your blood is being pumped. And arteries is what carries the blood to the heart. So blood pressure. So you guys know, like you go to the doctor, you get your blood pressure checked, or you have a monitor at home. And what do those numbers mean? That top number is your systolic number. That is whenever your heart is beating, it is the pressure on the arteries of the wall of your arteries during the beat. And this diastolic, which is the bottom number, and I think of diastolic, D for down, so you can remember diastolic is down. That is whenever your heart is at rest between the beats. And so what is a normal blood pressure? When I first started my nursing career, it was 120/80. It was perfect. But now the American Heart Association has lowered it because they just found out that that was still a little bit too high. So anywhere between 120 and 130s, when you're getting closer to the 130, you're considered like pre-hypertensive. So really, especially if you're a woman over 50, it's great if you can get it just below the 120 mark on the top number or right in there. Definitely try not to get it any higher. And when you get up to that 140 on the top, that's considered hypertension, high blood pressure. And that bottom number, we want to keep it below 80. If we can get it closer to that 70 mark, that is just perfect. Then you're not causing as much stress and as much pressure on the wall of your arteries. All right, I'm going to go into another part, talking a little bit more about what happens when you have high blood pressure and some things that it can cause problems on that. So let me know if you have any more questions on that. I will see you tomorrow. God bless. Bye.